and so needed, guys. So we need you guys to pay attention and tune in and join the conversation. Also, feel free to ask us any questions in the comments, and we'll try to get some of the professionals and panelists to answer it. So let's talk. It's all about talking about challenging but yet relevant stuff in the Black community. We want to talk about topics that we don't usually challenge ourselves to take on, and actually talk about it and explore it and assess it and potentially find solutions to some of the problems that some of us face, but we don't get to have daily conversations about. So this is brought on to you by Taste of Africa Northeast. Great organization, great charity, guys. Make sure you're following, make sure you're supporting, so we can have more projects like this to keep important conversations going. So with me, I have a few amazing panelists. I'm going to start with Andrew. Andrew, hello. Hi there. Can you see us?
Yeah. Hello.
Okay. Andrew, tell us, what do you do, Andrew? Actually, no, I'll say a little bit about you. Andrew is an engagement lead for an organization called Couth. Have I pronounced that right?
Yeah, you have. Yeah, definitely.
Tell us, what is Couth about?
So Couth is a free online service that offers emotional and mental health support for young people. So again, that's around, we're kind of currently commissioned in the whole of the Northeast, which is amazing. We're up and down the country. We've got about 95% coverage of the country as well. And we're commissioned by different clinical commissioning groups and NHS foundations. So my role is to go to schools, colleges, different youth organizations, and just explain to young people how they can sign up to our website.
Excellent. Okay, thank you for that, Andrew. Our next panelist, you're welcome. Good manners. Our next panelist is Dominic. Dominic, tell us a little bit about yourself. I know you're the founder of Tomorrow's Leader. What is Tomorrow's Leader about?
Tomorrow's Leaders Northeast is, can you hear me? First of all, can you hear me properly?
We can hear you brilliantly. Thank you for checking as well.
Yeah. The organization Tomorrow's Leaders Northeast is a social enterprise, and basically we do what it says on the tin. Our whole function is to help people achieve their ambitions. And it's as simple as that. So we basically have a mentoring role, and basically that's it. It's as simple as that. My own personal background is that I've been a counselor, a mentor, and a careers advisor. So I've covered a whole wide range of areas and worked with a whole range of people.
Okay, so you're kind of clued up in terms of supporting Rose, mentoring and mental health itself. Great. Okay, thank you for that, Dominique. Next up, we have Ian. Ian, you work for Mind. Tell us what you do at Mind.
Yes, hello there, Trish. Yes, I work for Middlesbrough and Stockton Mind, specifically for the Impact on Teesside project. Now, Impact covers the whole entire of Teesside, which is Hartlepool, Redcar, Stockton, Middlesbrough, all that area. And we are the IAPT service. So IAPT stands for Improved Access to Psychological Therapies, which is kind of like your first step into getting mental health support. Funded through NHS trusts. We are actually 3 organisations working together. So we are Mind, we are Alliance, we are Insight Plus, and we work with the trust itself to offer people from...
Were that the 3 organisations? Sorry to cut you off. I was just... So Mind?
So Middlesbrough and Stockton Mind, Insight Plus and Alliance. And we work with the trust itself to offer a primary mental health support.
Okay, thank you for that, Ian. Thank you for that introduction. And our next panelist, we have Joe. Joe, you also work for Mind.
Yes, I currently work for Mind. I've only been there a month, so this is
you
quite
work
new
there.
to
You
me.
work there.
I'm a program manager for a service which tries to reduce social isolation and loneliness in older people. So mental health is a huge part of what we need to do with our partners. One of the reasons why I was asked along today is because my experience of working with young people in a similar way on large programs and recognizing and tailoring services to enable mental health to be addressed.
Okay, thank you so much for that. I see there's a couple of people who seem to be experienced with working with young people and in terms of mental health. This is great because I have one question as well, particularly aimed at young people. But before we get started, last but not least for now, we have Kidest. I said I was going to ask you on screen to pronounce your name for me because I may not pronounce it like you can, but I'm hoping other people can, and I want to try every time you say it.
Don't worry about it. It's still challenging for myself in English. It's not English word anyway. My name is Kidest. I'm currently working for my sister place. They do service for domestic abuse client. Before that, I used to work for addiction for addicted client with Hartpool in Hartpool. I did have some experience working with children in Sunderland Impact. Also in Red Car, there was one, it was a short time, but yes, I did work with children.
Thank you for that introduction. So what's actually so amazing about this is that everyone seems to have quite a variety of experiences. So we could get a conversation going, and I'm sure we'll be able to kind of pick up different sections of mental health, and everyone will be able to chip in, which is great. So I'm really looking forward to this conversation. And also, guys, if anyone here has experienced any mental health related personal problems that they want to speak about, please feel free. It's a safe space. We're open, and that goes for me as well. So if I do throw in maybe a question that kind of applies to myself, please do receive it openly. So lastly, I wanted to say, actually, we might have one more panelist join us, but I'll give her the same opportunity as everyone else to introduce herself when she gets here. So one of the first things that I want to ask is, what is mental health? And I think I want to actually direct this at Ian. What is mental health? Because that's the topic for today, by the way, mental health, in case I forgot to say that. What is mental health, Ian?
Well, that is the million-dollar question, because it is so many things to so many people, and it has so many different names as well. So it could be mental health, it could be mental well-being, it could be just mental on its own. You know, people have different definitions of what it is. So for us, it is about how we manage our day-to-day life, our activities, how we're able to successfully pass through life and manage the challenges, whether it's through emotions or through an holistic approach where we are looking at society, things like managing our money, managing our job, careers and relationships and such. Essentially, it is covering every base of everything, really. Which is why we need so many different services and why we have so many different options for support out there.
Okay, so just so I ask everyone, does anyone have any other definition of mental health? Because the way you broke it down, I feel like it sums it up all pretty all together. I don't know if Joe, Kidest, Dominic, anyone else has any other interpretation of mental health, or there's something that Ian didn't mention in there, because the way you broke it down is perfect, but I always kind of simplified it for myself. I always kind of thought mental health is just the state of your mental being. I think often sometimes it's hard to kind of put it together as in terms of managing anything in life, anything that's happening around you. But also what I wanted to ask is, this is to anyone that wants to answer, actually. We can go to Joe. What are some of the misconceptions of mental health?
Okay, I think mental health can carry a huge stigma for people. People can hear the words mental health and think, I don't want to be labelled with that description. I think there's been an awful lot of, historical bad press, trouble in the media where mental health could have been portrayed as people who have mental health needs are dangerous. And all of that can, help or hinder people to recognise their own mental health and issues that or problems that they may struggle with. So, mental health is for everybody. All of us at some point in our life will experience, whether it be an episode of depression or anxiety, through to all sorts of other complicated, complex mental health conditions. But, You know, it can affect us for an hour, it can affect us for our whole life. And it's finding the right support to meet the need you have. But I think the stigma has been the biggest problem. And I think it's great that nowadays we're able to talk about it more and able to engage people in a way that doesn't stigmatize them.
Yeah. You mentioned something really interesting there that caught my attention. You mentioned that at some point, you mentioned people will experience depression or anxiety. I just wanted to clarify, is this something that's likely to happen to everyone? Or is this something that's happened to some people or very few people? Is this something that's factual for all of us? Or more, you know, do you understand what I'm trying to say? Is this something that can happen to anyone or does happen to anyone?
I think it does happen to anyone. Yeah, it can happen to anyone, and it can happen to any one of us at any time, regardless of, you know, money or happiness, or, you know, self-contentment. It is something that can happen. I'm sure some of the others on the panel who are therapists, counsellors, support workers themselves would be able to say more about that as well.
I actually wanted to go to Dominic. I wanted to ask, why do we think that mental health itself is a taboo in the Black community?
I think there are so many pressures on Black people, so that we can never show weakness. Because, you know, Joe said it, you know, there's a stigma attached. You know, so a lot for the majority of Black people, there is everyday issues with just existing in the UK. So in my experience, people just don't want to put themselves in a situation where you're giving people ammunition against you.
So do you think maybe acknowledging that, if someone acknowledges the mental health state, it can almost feel like giving people ammunition to use it against you?
Absolutely. So the way around that, that's one of the reasons why I'm here, is that, you know, if you have, you know, some people who are maybe elders with their gray hair, who can openly talk about these things, then, you know, it breaks down the barriers. So, you know, I'll freely, you know, I've had conversations with people, you know, myself, you know, I've had a relative who committed suicide.
I'm sorry.
Right. So it was a long time ago. And so, you know, and they had, that particular person had everything going for them. So as I say, it can happen to anybody, anytime. You know, you never know somebody's mental state unless that's why this thing is so important. You know, let's talk. That is the first thing, you know. So it's just a case of like, okay, when there's that British thing of like, how you doing? And then people don't really want to know. They just want to get on with their day. So it's a case.
So is it more like part of mannerism? Really checking on how someone's like that question is like what do you call it? Like I can't think of the term.
Yeah, it's just
like a well-mannered question.
It's just one of those filler things like, well, have you seen the weather today? Move on. Do you know what I mean? So, but it's a case of like, how you doing? No, how are you really doing? I really want to know. Are you okay? Because like somebody else said, everybody is going to go through something at some stage, anxiety, depression, or whatever, like, you know, and some people have the coping tools at a particular time, and some people don't and need help with that. So, you know, there is stigma attached, as Joe has put it, but it's a case of some people, and lots of communities are the same and different, you know, different issues get closed in. So, but as you said, within the Black community, it is an issue. It's something we don't talk about, but you know, we do need to talk about it, and we have to, you know, we have to hold our hands up. You know, we're people are people at the end of the day. Absolutely. Thank you for that, Dominic. You raised a really good point there, but
I want to throw that one at Sylvia because I want to introduce Sylvia. Welcome, Sylvia. Welcome to Let's Talk.
Thank you. Good evening, everyone. I have to apologize for my tardiness. I had to do just a little bit of mummy duty.
Okay.
Hence why I'm a bit late. But good evening, everyone. It's nice to be here.
Thank you for being able to join us. I'm going to give you a chance to introduce yourself. What do you do, or how do you tie within this topic? How are you passionate? Is this just your passion? You know, what's your tie to mental health?
My name is Sylvia Ochuba, and currently I work as a navigator within the community in Middlesbrough. And one of the things that we do is try to reduce barriers in helping people move forward into employment, training, and education. And one of the major barriers that we see is usually mental health, financial inclusion, and digital inclusion. But I know BAME, the word BAME, it's almost been phased out now because it's not very appropriate. But when you look at my complimentary card, it actually says BAME Specialist Navigator. So I work mainly with people from the minority community. And one thing that I've come to realize doing this job for almost 3 years is that mental health is is a taboo topic. So even when I bring up mental health with my participants, I don't say mental health. I have to, first of all, create a scenario where I put myself in that scenario, and then I make them relate to that scenario. So if I want to bring up a mental health conversation, I say something like, oh, you know, I woke up this morning in a really low mood. And for some reason, I couldn't really put my finger on it. I couldn't sleep. I was feeling very breathless. But then I realized it was just because there was a situation going on, you know, at home, and I was able to address it, talk to someone, talk to my mom or my auntie, and it was like a good outlet for me. And then you see that person go, oh, you know, I felt this way the other day. And you know what happened? They tend to open up. You know, so even when we talk about mental health, I don't go into it as, oh, let's talk about mental health. It's a very taboo topic within the minority community. And I think it's something that we need to start talking about. The last speaker, the gentleman who spoke previously, you know, he made some valid points about it. And I think within our homes, we need to start addressing it as well. Especially within the Black community, we need to start addressing it, because one thing I've come to realize is that the younger kids will mirror what they see. So when they see people speak down on you or treat you in a way that almost triggers your mental health, and you don't do anything about it, they don't do anything about it when it's done to them, because it's almost it's not almost. You've accepted it, and they think it's all right for you to accept it. Do you get what I mean? And then if someone does that to them, they accept it as well. So I think it always starts from the home front. We need to be very careful what we accept and what we don't accept. And you know, kids will always do what they see. And I think right now we're working on it, but we have a lot of adults within the Black community that are really struggling and cannot speak up. So the people we need to work towards catching on time are the younger generation. And catching them is telling them it's okay to speak on it. Nothing is going to happen. You have no reason to be scared. No one is going to sideline you. Nobody is going to isolate you. And you know, with children, sometimes when they say certain things, you clutch your pearls, you know. And I think we just need to give them.
Sorry, just is that have you got like an example for us?
Let's give you the typical one, the ones that happen in school, where children are almost sidelined or isolated. Oh, this person doesn't want to play with me, or this person doesn't want to play with me. You see, most parents will come to me and say, oh, my child feels isolated. And then you say, what did you say to them if they felt isolated? Oh, I just told them it will be all right. Did you book an appointment with a teacher? Did you speak to the head teacher? You know, Those sort of things, letting them know that it's okay. And you know, there's this little myth that people believe, oh, if I speak up, they'll pick on my child.
Yeah.
I don't want my child to be picked on. And I kid you not, I've had instances where children have almost felt like they are being picked on by their teachers. And this is why certain parents do not want to speak up. So I think it goes across the border. We need to start speaking up in schools. We need to start speaking up in communities, the workplace. The workplace, you know, it goes a long way. And the way we can encourage this is by having conversations like this, open and honest conversations, and saying, how can we encourage this, not just within the Black community, but within every community, extending it within every community. Because imagine someone who's vulnerable, and then they come across a situation whereby they're made to feel even more vulnerable and their voice is taken away from them. It's heartbreaking. So it's something that we definitely need to address, and I'm glad that we're doing it today.
Thank you so much, and thank you for that. You and Dominic both mentioned something very interesting there. I think it was a perspective of learning from the elders, you know, because I think Dominic highlighted that we don't really see our elders talk about mental health or even really acknowledge it as such a thing. I think the first time a lot of us have heard about mental health is usually outside of our homes and the importance of it. So I wanted to go to Andrew, because I actually wanted to ask, in terms of your community, is there a similar experience? And also, as someone that works with young adults, I'm guessing you work with young adults from different types of backgrounds. Can you always tell when there is a lack of that conversation in their homes? Is that something that's always evident to you when you come across a young person where you're completely just conscious of the fact that actually this is not a conversation in their home based on maybe how they handle things or how they respond to anything around them or conversations with you?
Yeah, definitely. I think not just in, you know, our community, and I think just many young people don't have these conversations, and, you know, it's difficult around the stigma, and, you know, just to echo what everyone said, the negative images in the press, the way language is used. Again, I'm really quite into young male mental health, and it's something that I feel really passionate about. I've got 2 young boys as well, so again, it's something I feel really passionate about. And with males, there's that extra stigma, and again, in our community, there's even more pressures for young males, you know, with everything going on. And it's just even.
Can we, sorry, before you skip past it, can you just elaborate why there's extra pressure for young males in terms of mental health?
There's a lot of there's a lot of pressures with them. So, you know, young males aren't, or they think that they're not allowed to express themselves. You know, young males aren't allowed to cry because it's seen not masculine. You know, there's terms going around like man up, and, you know, all these different things. And there's those pressures on young males that they feel like that they can't express themselves, so they've got to bottle everything up. You know, they can't be seen to cry because it's a weakness, so again, they'll bottle things up. They might not be able to speak to the friends or the parents, the guardians, the carers, or whoever, you know. Again, there's the pressures of society to go down a certain route as well, you know, maybe grow up, get married, you know, again, bringing in sexuality, gender, you know, we could be here all night, all the different things. And again, you know, with the other person Dominic brought up, you know, suicide. Again, suicide's the biggest killer for young males between a certain age. I'm not sure of, you know, off the top of my head, but yeah, it's a certain age group that's the biggest killer of suicide. And I do know 2 people have taken their own life as well, one in my community and one a young lad when I went to school. And again, you know, he was a grade student, got him to go to Cambridge and everything. And you think, you know, looking on the outside, you know, everything was fine, perfect. Something I do with my friends, I'm always checking up on my friends, talking to them, finding out how they are, you know. again, something similar to, there was a documentary about male suicide, and it's something that they do, and I've started doing it. So you ask your friend, you know, how are you? Yeah, you okay? Yeah, good, thank you. But you ask him again, you know, no, really, are you okay? And then you give them the opportunity to, so ask them the same thing twice. And yeah, we're all like, yeah, we're fine. You know, when you ask someone, how are you doing? Yeah, I'm good. But then when you ask them again, and then people will open up. And also, again, with the current climate, with the pandemic, with us kind of being in and out of lockdown, everyone has been forced to feel some sort of mental health issue, whether it's your own mood going up. And I'll be honest with you, my mood has taken absolute, you know, it goes up and down daily. And I've started running in my lunch break. I go out for a run, and again, just to help improve my mood. And it actually has helped. And it's that target to go against. And yeah, it's just really has helped. And I think everyone's been forced, unfortunately, into doing things to help improve their mental well-being, whether that's, you know, having conversations with the friends, you know, webinars like this.
I was gonna say that, having webinars such as this.
Because if it wasn't for, you know, the pandemic, or would we have these conversations? I think people have been, we probably would, but, you know, it wouldn't be as obvious as well. And yeah, with regards to the young people that I work with, so with Kooth.com, it's a website, and everything is anonymous, so young people would access our service. They put in some basic details of like where they're from. We do take gender, we do take ethnicity as well. But yeah, a lot of our kind of stuff is anonymous, and kind of young people from, again, I don't like this term, I'm going to use it, the Bayern background. You know, it's very difficult, and again, it's something I'm passionate about, especially alongside with male young people. And it's just having these just even like, thank you for inviting us all, because we're so appreciative, and just having this conversation is an absolute massive, it's a first step, and it's really needed. And like you said, you know, having these conversations will open up other people having the conversations. And yeah, just personally for me, I've had you know, friends who have kind of suffered from, I say suffered, I shouldn't really say that, but have had mental, and again, it's the language you use around mental health as well, like suffered, you shouldn't really said suffered. People say, oh, this is crazy, again, you know, the negative connotations. It's there's so many different things, and we've got to really watch how we use our language. But yeah, if you think as well in films, you know, the person who's usually kind of got mental health issues, like portrayed as a baddie, you know, a bit of a psychopath, you know, murderer, you know, if you just think of these negative stereotypes that we have, people are going to think that the friend who may come to them and say, you know, I've got a mental health issue, they're going to think, oh, they're going to brand a knife, they're going to start, but it's not that at all.
Is there anything like what we've seen before on the TVs and those type of misconceptions?
Yeah, and the media as well. I know, like sports stars, you know, celebrities coming out and talking about it. Tyson Fury, I've got a lot of time for him, because I know he went through depression. He's got bipolar, and he's quite a positive role model for young people. And again, Frank Bruno, when Frank Bruno kind of came out back in the day, and he had kind of depression, he was in the newspaper. If you look Google, he was like called Crazy Frank and stuff like that. And again, it's just,
when was this?
This was like back in the day, I'm sure my age now, but yeah, Frank Bruno, when he was going through like depression.
Okay, I wanted to compare it with the time.
Not recently, but yeah.
The fact that you're saying back in the day lets me know it was back in the day.
Not too far back in the day, I'm sure my age.
Okay, I thought it was so far back in the day you didn't want to say the time.
No, I'm thinking like 90s, I think maybe. But again, there was loads of, you know, and it's just really, you know, sad that the media would call him Crazy Frank. Like the guy's having has got depression. Like
you would think they would be more accountable about what they put out there into the public.
But again, that was in the 90s, so things have changed as well.
It was in the 90s. I like that you actually mentioned the fact that there seems to be some sort of difference between the 90s and now, which it must show some sort of progression. I want to throw this question to Ian, actually. Hey, Ian. Would you say there have been some form of progression from how mental health was perceived before to how it is now?
Yes, there certainly has, but unfortunately it just isn't enough. As I'd just like to parrot what everybody said, it is absolutely right. You know, whether it's portrayed through the media, through films and such, we still have this Victorian attitude when it comes to mental health. You know, if you think about how many horror films are based in asylums, we have this, you know, the treatments that people used to have to go through with being covered in water and all kinds of horrendous things. And that is still perceived today, you know, with ECG, you know, and those kind of treatments. But the model has changed dramatically. The support has changed dramatically. The way people get that help and the means and the progression has changed dramatically. Unfortunately, the message still isn't really being put out there appropriately. And this is what we need to be doing more and more.
What when you said the message isn't being put out there appropriately, what may be considered appropriate in your line of work? You know, what more could you encourage?
Well, exactly, again, as what people have already said, it is about that open discussion of being frank and honest. And it is wonderful when we have people who have the experiences of mental health or mental well-being, and they are able to tell their story. I'm a huge advocate of peers coming into our service, and I specifically run workshops. I'm part of the service that is called Recovery, and we run the Recovery College workshops where we actually have people who come through the system. We give them some training, and then they help us out within those workshops, and they are highly successful because rather than having somebody who has been to university, got a degree and all those kind of things, who's been there, done that, won the
someone who's had the experience. Because as I think someone had mentioned, I'm so sorry, someone has mentioned, I think it was Sylvia actually, she mentioned that a good way to get people to talk is saying, like using herself as an example. Suddenly that relatableness is, I guess, is what, so would that, sorry, I'm thinking of so many questions here because you said so many good things. So I was thinking, in terms of getting people to open up, would you say it's very important for any practitioner or any mental health worker or enthusiast to be very open about their own experience? Is that something that could be required from the people?
It can be really beneficial, and we might as well use myself as an example. I was diagnosed with borderline personality disorder, as well as PTSD and a few other, like anxiety, depression. And I received the appropriate support, which was absolutely fantastic, thankfully, and I was able to progress up to the position where I am today. And obviously, saying that I'm a big advocate of being a peer is because I've been there. I've been one of those people. I'm now able to pass on that knowledge, that experience to people and explain, well, rather than that whole perception, whether it's from the media or the films or you know, just the communities, people in the communities not feeling able to communicate. And you know, we've said it before, you know, people were told to man up and things like that. But now we are getting a different message out there and saying, actually, it's not something to be ashamed of. It's not something that we should be frightened to talk about. And it's really empowering and really powerful.
Just hearing you say that, it made me feel like, oh, suddenly I could just tell him all about my anxiety, because he's been through it. So it was very powerful to hear that. And also thank you for sharing that with us. That the vulnerability really does open doors. I want to ask Joe, so we've acknowledged here that, you know, we need to be quite frank in terms of conversations. It's good to be vulnerable if you have experienced it yourself, as it kind of helps the other person feel more comfortable, the create a safe space. And also I think either Sylvia or Dominic mentioned the importance of asking the question twice. I think it's Dominic and Andrew actually, the importance of asking the how are you question twice, so that the first time, as us British do, we kind of do it for decoration, don't we? So I guess maybe the second time is like, no, actually, how are you? I'm trying to check. But also I wanted to ask you, Joe, as someone who works with elder people, Dominic had mentioned that in our community, it's very rare to hear older people mention anything to do with mental health. Is very, very rare. Is this something that you notice that maybe is facilitated easily in other communities? How are other older people managing when it comes to mental health?
I think in older communities, mental health has a very similar perception amongst people, because it was something that wasn't talked about. It was, you know, I mean, I remember when I was a kid, people saying about the yellow van coming to pick people up, you know, and it was, you know, in the 70s, that's very much what it was like. And so I think, you know, people of the older generations, I mean, you know, 50 plus, that includes me. So, you know, it has been very difficult, I think, and a lot of older people are also very lonely and very isolated, so they really feel that loneliness. There's some people thrive on having alone time, you know, but for a lot of people, they really do need connections with others. And, you know, as you get older, we tend to lose family members, you know, and your network restricts. So, but I think one of the ways that we do it, I mean, I run the Aging Better program in Middlesbrough. It's a lottery funded program. And programs that I've run in the past, I think it's about embedding mental health into all the services that are there. So you make it easy for people to access it. Like Sylvia was saying earlier, you know, make it a part of every conversation you have. That's not asking people, you know, have you got mental health needs? It's having a conversation, you know, being kind, having a conversation with people about how they are, and allowing them to speak. And I think we've talked about, you know, some of the stigma which can be associated in different communities, including, you know, older people. And I think if mental health support at different levels to meet different people's needs, if it's available without having to overcome a huge barrier, without having to walk to a particular place and go through a particular door that is recognised as a charity that delivers mental health support. You know what I mean?
Yeah.
So that it's easily accessible. I mean, Andrew's been talking about Couth online. Yeah. Obviously, that's easily accessible, especially to young people, if they do have the access to the internet. And it makes it, it's less of a disclosure in talking, in going and searching for it. If it's there readily available and easily accessible to people, I think it's more likely that they'll pick up on that support and find some coping strategies for themselves.
And speak about it. Thank you for that, though. Kidest, since we are talking about the subject of elder people, I know that you worked a lot, you supported a lot of Ethiopians in the community. What is it like for the elders in the Ethiopian community?
It is similar, actually, the same as the other community. There is a very huge gap between communities. There is lack of awareness in general about mental health. There is a mixture of thinking culturally and religious way, and then people stigmatize each other, thinking they mental health related to something religiously or there's cultural thing. There is also lack of awareness in general. People get embarrassed to tell, and also they don't identify if they have a mental illness in general, and they don't come out to tell you I have this issue, because one thing, there is stigma, as it mentioned earlier. Stigma itself will cause them to be isolated. There's also their own like personal pride, like, you know, putting themselves in vulnerability. They don't want to put themselves in that position. So I could say they don't talk at all. I never heard anybody talking about mental health in my community at all. There's a thinking of like this is a religious issue. So don't isolate that.
How do you get the community or the people that you're supporting to sort of differentiate between spiritual and psychological?
I could say it's never been talked, to be honest. Like, you know, there's a very big gap. I can't say it's only with my community. I could say, like, you know, I came across different people, you know, coming for counseling with in general from Black community or just any other communities. There's a lot of awareness in general. People don't identify if they have mental health issue. They put it in like culturally or religious way, or they have fear of isolation. If they come out and they speak out, they fear they will be isolated. So there's a gap between communities. There's lack of awareness in general for people.
Thank you. I actually want to throw that question at everyone, because I realize that actually everyone might have a different interpretation of how maybe they themselves interpret between the difference between psychological and spiritual, or maybe how they can help others interpret. I wanted to ask, let me go to Dominic. Is that how do we differentiate what's psychological and what's spiritual, or how do you advise other people to differentiate the two, if you have any tips?
That has never been something that's come up, actually, in my experience. So I have to pause for thought on that one.
Yeah, well, that's okay. Wait, Sylvia, do you have, or maybe think of it as me asking, if I was to ask, how do I know the difference between what's spiritual and what's psychological?
So that's actually a good question. Like Dominic said, it's a question that hasn't really come up.
Yeah.
To be fair, I've never really heard that question anywhere. But let me put it this way: spirituality for all of us is different. You see, we're all different individuals, and we're dynamic in our own different ways. Spirituality is where we find our solace. You know, when you bring 5 Christians or 5 Muslims and you tell them to describe spirituality to you, you will get 5 different answers of what spirituality means to them. Now, when we get to the psychological part of it, we now have to actively listen, you know, turning on our active listening skills, listening to it and seeing, is there a pattern that we can see? Is there a pattern that we can find? I'll give you an example. I once worked with a lady in the community who said to me, oh, I think there's something wrong with me. I might be possessed. And I said to her, okay, tell me about it. And she goes, oh, I'm hearing voices and I think there's someone in the house with me. And I said to her, okay, and what makes you feel this way? And she begins breaking her story down, you know, opening up layers of her experiences. And immediately it hit me.
Yeah.
It hit me because from the little she had said to me, I could see that she was an expectant mother and she's got 3 children with 1 older one. And the experience with the eldest one had trickled down to the other kids where she couldn't make a maternal connection to her children. And the moment I was able to piece all that together, I said to her, how about we get in touch with your midwife and see if we can get you some prenatal mental health care. And she said, oh no, they won't understand me. Immediately there was that barrier. Oh, they won't understand me. They're just gonna stare at me and think that I'm just one of those crazy people.
And this is her referring to the midwives who are essentially trained to understand women.
Yes, and she hasn't spoken to them yet.
Yes,
but this is and this is where we now need to realize that the way we say things, like Andrew was speaking, we need to be very careful how we speak around people, the words we use around our children. It has a ripple effect. And she goes, oh, they're going to see me as one of those crazy people. And then I said to her, but you've just said to me things about how you feel. Did I look at you like a crazy person? And she goes, no, you understand. And I said to her, what makes you think I understand? And then she kept quiet. And I said to her, you've got to give these professionals a chance. Just because you've heard Mr. A, B, and C say, oh, they're not going to help me. Have the experience yourself. Go forth and have that experience yourself. So you see, she felt like her problem was spiritual. She said, I feel like I'm possessed. But when you're somebody who's in tune and who has the tools to understand, okay, there has to be some kind of symptoms. What's going on? She's not able to sleep. You know, she's having probably constant bowel movement, you know, this uneasiness, coldness of the feet, coldness of the hands, excessive sweating. What's going on? probably always hyperventilating. And the next step of helping her was getting in touch with her midwife. I was actually in that meeting. She said to me, can you be in the meeting? And I sat in that meeting. I kid you not, she refused to speak in that meeting. I was then asked if I could speak on her behalf. And because I had written down with her permission when she was speaking to me, I wrote down every single thing she said to me. I then read it to the midwife. And that way she was able to be put on certain medications and talking therapies that helped her. And then she saw me the next time I saw her. I actually saw her on the street and I said to her, oh, you look lovely. And she goes, oh, I've been working with so, and I feel so good about myself. It was lovely to see her in a different light.
Did she eventually get to the point of speaking to the midwife?
Yes, she did. She actually started.
Sorry.
No, it's okay. She actually started going to talking therapies. And I also think after the baby she put to bed, she continued with the mental health aftercare, and it was absolutely fantastic. Seeing the before and after change is just phenomenal.
It's just phenomenal. What, in the end, was she able to realize the difference between the two?
Definitely. She now actually speaks about it, and when people come to her with the whole you know, coming from an African background, we have this thing about witches and wizards and being possessed, you know. And I say to people, all these people that are called witches, I kid you not, when you tell a child you're a star, you're a star. Tell a child you're a star for 3 days. On the 7th day, ask that child, what are you? That child will tell you, I'm a star.
They're a star.
But when you wake up every day and you tell a child, oh, you're a witch, that's why your mom and dad died, or that's why your hair doesn't grow, or that's why your stomach is protruded. Keep telling them they're a witch. One day, that child is going to wake up and you will say to them, what are you? They'll tell you, I'm a witch. It's that thing of acknowledgement. It happens with, I can attest to it, you know. It happens with even adults. When you speak nicely to the adults around you, oh, you look beautiful. Oh, you look gorgeous today. I would wake up the next morning, look in the mirror and say to myself, girl, you look lovely. I would actually say that to myself, you know? So it's a cultural thing that where I think we've actually misplaced that whole spirituality aspect, and we've used it in such a negative way, you know, and it's affected people and literally hindered their mental health in ways that is almost irreparable for certain people at certain ages.
You have just answered my next question, actually, because I wanted to ask everybody in all your sectors, obviously I'll go name by name, but I wanted to ask everybody, do you think that religion and culture affect the way people think, the way they process their mental state? The first person I want to go to, actually, let me go to Kidest. In your sector, does religion and culture impact and has an effect in the way people process things?
Yes, really affects. I do believe in that 100%, because the reason to say that people wanting, there is a confusion between mental health and religious belief, like, you know, as it's mentioned there, they feel like there is you know, as it's mentioned, the witch and other stuff, they have that sort of belief. And also when they have a mental health problem, they will actually link that to the religious belief. There's something possessing me, negative spirit to me, then I will deal that religious way. They prefer to go through in prayers or dealing in their cultural way. So people don't identify it, the existence of mental health, actually. Don't think in the psychological way. There's also culture which influence people, which I came across. Culture by itself, wanting, having mental health issue itself, will create that person to be isolated, because most of like our Black community has very limited knowledge about mental health. They don't talk between each other. There is also isolation. If they think somebody has these issues, they will isolate that person. They think that person is like a psycho. They try to go away. They don't discuss about it. So lots of issues will impact actually in general. Culture is, and religion is the major issue.
Yeah, Andrew, I see you just agreeing with a lot of things there. So I had to come to you next. Do you completely relate and understand what Kidest is saying? And is this something that you experience as well with patient clients and your own personal experience in terms of culture and religion? How does this play a part in mental health?
Yeah, it's a really good question, and I think from my kind of experience, and not just at Kidest, but in different roles I've worked in. So again, I used to work for Darlington Mind, a local mental health charity, and yeah, it's interesting between kind of the religion and the mental health aspect, or even thinking. So my background is Caribbean. So my mum is from Trinidad and Tobago. My dad was from Mauritius. So, and then obviously I've been brought up in England. So yeah, it's and again, you know, just that is difficult within itself, of not being able to belong to you know, with identity, and again, you know, bringing into my own personal mental health.
So identity is a thing that should be acknowledged as well.
Yeah, 100%. Yeah, it definitely is, and it's difficult, you know, growing up in a certain area in the northeast, you know, not looking like anyone else, or you know, feeling quite isolated, or you know, being treated a certain way, being called certain names, you know, having certain kind of pressures upon yourself as well. And it's very difficult. And again, you know, it's something that I've not. So when I was younger, I used to have a lot of racism, a lot of racial abuse when I was like a young child, you know, and obviously didn't process that. And it's not until recently I've realized, you know, that has had a massive knock-on effect to my mental health. When I was a young lad, when I was a small child, I got jumped in a park because of my ethnicity. And
I'm so sorry.
No, it's all right. It's quite hard to talk about it, but you know, opening up. And I've only recently, you know, gone back to that park because obviously it's triggered emotions, and it's brought back memories and potentially PTSD to a little bit, to be totally honest. And you know, it's not until I've kind of worked in this field and, you know, thought about it and thought really, you know, seriously about it. Yeah, you know, that has had a massive effect on, you know, my mental health. So not really talking about religion, but, you know, looking at like, you know, isolation, you know, being of a certain community, you know, and yeah, and I think it's just, again, just making things a bit more normalized. So first step is having these conversations when you're talking to other people as well, realizing that you're not isolated. You know, when I speak to my friends, you know, a lot of them have kind of gone through depression, stress and anxiety, and, you know, just having these conversations, just normalizing it. You know, they'll be like, oh yeah, I was on medication for this, A, B, and C. And it's like, oh yeah, cool. You know, other people I know have been on the same thing, having conversations. And again, you know, people getting counseling. I heard a really nice story where, with your physical health, if you wanted to get fit, you'd go to the gym, you get a personal trainer, they train you up, you know, you do your weights to help you fit, essentially. But with your mental health, the equivalent of that is a counsellor. And a counsellor is somebody who can help you, who can train you, who can help you get your mental health, you know, right. And everyone's got mental health. With my young people, I do again, you know, put your hand up if you've got mental health. And, you know, a couple of people might put the hand up, but everyone has got mental health. Again, it's just distinguishing between the mental health issues and the mental, like you say, hey, you know, you got your hand up there, everyone's got mental health. So it's really.
Oh, so quick. I realized after I was like,
I think you're frozen now.
Oh, am I frozen? Oh dear.
I thought you were just dead enthusiastic, but yeah. And again, it's just the stigma. It's a word that you're going to hear time and time again. And how are we going to get rid of this stigma? Having these conversations, you know, everyone realizing that, you know, just normalizing it again. with Kooth, again, to bring it back to Kooth, I think the great thing about Kooth is because it's early intervention. So, you know, we're not waiting for young people to be in crisis, to be at the risk. Prevention is better than cure. And my colleagues from, well, my colleagues, the people from Mind will be saying, you know, if we can start having these conversations from the younger people, basically it's going to mean when they get to adults, there's not the knock-on effects for the services isn't there, you know. And again, with looking at the young people services, it just breaks my heart how big the waiting lists for CAMS are, and you know, that support. Luckily, we do have a lot of mental health kind of support out there. I've got a meeting with somebody from Middlesbrough and Stockton Mines next week, actually, with their youth project. So again, it's amazing. It's just working in collaboration with all the different organisations around here, and there is a lot more than you think. But it's not until you kind of do a bit of research yourself, you know, have these conversations, get rid of the stigma, normalize things as well. So and also it's my mum that keeps asking those questions on the chat as well.
You know what? I was just about to say, actually, I was going to say, if someone can keep bringing up the questions that are being asked, because they come so quick and go, before I could read them, I'm like, it's gone. Because I think someone mentioned something interesting about there's a word in the Indian language, but I couldn't even finish reading. All of it is gone so quick. So if they can be brought back or
do you want me to read them? Because I can see
yes, you're so useful. Thank you. Yes.
Co-host. So, hi mum. It says it's important to emphasize that if someone is physically unwell, they seek medical advice. However, with mental health, there is a reluctance to seek support and medical advice. And again, there's no word in the Indian language for depression, so it has to be teased out in a different way.
I guess that's another aspect of how culture can play a part in it, because I don't think there's a word for depression in my language. I'm Congolese. I cannot even think of one. I think the only way I'd ever be able to talk about the depression is in English or in French. Just to ask anyone else, Dominic, Sylvia, Kidest, Joe and Ian too, is there a word of depression or mental health in your native languages, if your native language is different than English? Anyone? So Sylvia, is that a no? Dominic, is there such a word for mental health?
My native language is English.
Okay. Well, there is, I guess for you there is. For let's go to Joe. Is there another language you speak outside of English?
I'm really disappointed to say I don't speak another language, and I wish I did.
You know what? I don't just want to assume, so I've got to ask everybody. I've got to be fair, okay? Yes. Ian, do you speak another language outside of English?
Well, I was brought up in the coal mines area in East Durham, and it isn't another language, but the dialect is a lot different. In fact, from different village to village, we have different words for different things. And as I said earlier, you know, people would say mental. You know, that's how they would phrase it, and it's not a nice word. It's got horrible connotations, but that's their definition for it, and that's how it would be phrased around in the coal villages of where we were brought up. So,
it seemed like with English, people seem to stop at that first word, and I think it's the first word that sticks in, and so it's just almost automatically rejecting anything else after mental, because you just associate with the description rather than the actual meaning behind the mental health. The two words coming together, right?
Absolutely, yeah. That's the problem, and it's like any of the other kind of synonyms, whether it's crazy, which is already mentioned, or mad and madness and things like that. You know, they all have lots of negative connections.
The association to the word,
exactly.
The word mental itself. Is there? Do you speak any other languages outside of English?
I do speak Ethiopian language, but I don't think we have different language. Actually, we use the English word depression.
Okay.
But I don't really think people know what means depression. They relate that, as it's mentioned, like mad person or he's crazy. But they know what depression is for those who are living in this country now. But we don't have any language. I don't know, there might be, but I never came across different words.
Could you say this could be an obstacle or some of the things that makes it hard for people in the Black community or for people who don't speak English? Well, I got a question there. So Andrew, this is what I need you to come and do your thing. Please, can you read that for me? Because I didn't catch it on time. Andrew, did you get that?
Yeah, sorry, I was chatting away. I forgot I was on mute.
Sorry.
So I did some research on maternal mental health 20 years ago. So I know that many women, if you say, are you depressed? They will say no. However, other you can ask, are you crying a lot or something similar? So yeah, they won't kind of acknowledge that they are depressed, but, you know, just trying to figure out different ways to
deal with it.
Yeah, to get that. They might not think that they're depressed, but again, the question says that they'll look at different ways to determine whether they are or not 20 years ago.
Okay. Thank you. Thank you for whoever sent that. Going back to Kidest, I was asking, do you think, because you've got, everybody has stated pretty much that in their language there's no word for mental health and hardly depression. Can we say that language is one of the barriers that kind of prevents Black people, Black communities, or the BAME community from accessing mental health resources?
I don't think it's only language. I think it's lack of awareness. They do have understanding. So at some point, they understand depression. Like most of the Black community, they are like migrant people who are asylum seekers or refugee. At some point, they all have some experience, especially trauma. They have depression, stress, anxiety. They all go to mental health institution and they have some knowledge of depression. But they link that to mental health, like being mad, being crazy. So they do, if, you know, when you refer them to counselors, so they're not happy to go there because they link that to that mad or crazy person. They don't want to be labeled in that person. And there is shame between community each other, between, you know, their community. They don't want to be labeled as that person. They don't want to be isolated. And also that sort of respect what they wishing to have. So that's like a kind of humiliation to be there at that point.
Yeah.
And also trust issue going, you know, being opening their problem to the counselor or for any mental health support area.
You said there are some trust issues there, did you say?
I think, yeah, there's sort of fear, because if I open up, if I tell my experience, they put me in sort of this place, or they put me, they will, you know, there are lots of fears. It's coming from lack of awareness.
Lack of awareness, yeah. Okay. Thank you for that, Kidest. I want to thank Andrew's mum as well. Was that comment from her? Andrew's mum, keep those comments coming, and I will keep Andrew co-hosting and reading it out for me. We're loving it. And if anyone else has any questions or comments, please do comment. I will try my best to get Andrew to read all of them, since he volunteered himself as a co-host. I wanted to go on and ask Sylvia, actually, what are other challenges that people from the BAME community face when it comes to accessing mental health resources?
Can I just mention that Jo has her hand up?
So sorry, Jo.
I don't know if
so sorry. Jo, go ahead, Jo. Sorry, what did you want to add on to?
Thanks, Sylvia. I didn't know if it had worked then or not.
Oh my God, I'm so sorry. I'm so sorry. I'm paying more attention now. I'm going to be looking at everyone's screens now.
No, that's fine. But just picking up on something that Kidest had said about refugees and asylum seekers, and the discussion we've been having about language and that being a barrier. And I've talked about mental health being embedded in a holistic way within services and other programs and support that people might have. I've recently moved up here from Sheffield, actually, but prior to that I was in Nottingham, which is an incredibly diverse community right in the middle of Nottingham City. And we had a lot of refugees and asylum seekers, and in Sheffield as well. You know, we were recognising professionals around different organisations. Organisations in the community were recognising the level of need for mental health support amongst refugee and asylum seeker communities. but found it very difficult to engage with those people because of the, you know, the things we've talked about this evening.
Yeah.
One of the ways that we tried to overcome that was by offering a way in to people's feelings through art. So we were able to, you know, run creative workshops for young asylum seekers and refugees where they didn't have the language. They were able to express themselves in other ways. And perhaps through that, you know, we're able to bridge into services that were appropriate for them. And I think, you know, as Kidest and Sylvia has said, and others, that it's very, very difficult. And you know, the experiences of asylum seekers and refugees in particular, you know, they will carry an awful lot of trauma with them.
Yeah.
And, yeah, it's important that we can do something about it.
I like the fact that you highlighted, you know, that refugees and immigrants will tend to carry a lot, and kind of keep it in them. And I think it's also part of our culture, to be fair, is that having the get on with it attitude. At least for my own culture, that's seen as a coping mechanism, actually, to be like, okay, I'm just gonna have to get on with it. Does this play a part in the amount of people that then have end up struggling with PTSD in the Black community? That anyone could take that question.
I think so, yeah, because you know, if we've talked about the barriers to recognizing it in yourself and being able to do something about it, and worrying about how people may see you. And in the beginning, I think Dominic was saying, you know, I've lost my track now. It was about.
Well, I was asking if the fact that in the Black community we seem to have a get on with it attitude, which I'm assuming would then cause a lot of PTSD, because they're just kind of like a dragging on of mental health crises that we haven't dealt with, that like leave a trail of PTSD. So is PTSD something that could be quite common then in our community, in the Black community? And obviously I know you're not in the Black community, but due to your work and experience, is this something you find very commonly common in the BAME community when you do work with them?
I think in my experience, I've worked with a lot of disadvantaged and underrepresented and vulnerable communities. Yeah. So for me, I think mental health need has been, you know, pretty equally spread amongst those people, because, you know, all of those people, all of those communities, including myself at some points in my life, have experienced, you know, discrimination, poverty, lack of opportunity, inequality. And I think it's almost like those things which create trauma and stuff we carry with us. But I think it's what's really important is, as we were talking earlier about maternity and children, you know, it can affect through a family, through siblings, and I think, you know, the earliest, like Ian was saying earlier, it's about getting in with early intervention, and like Kuth does as well, to try to you know, to stop it becoming a very endemic and damaging issue for a whole family. I don't know if people would say things in a similar way.
Yeah, let's find out. Dominic, what do you think that we can do as a community to raise awareness of mental health in the community? What can we do? Oh,
sick. I had myself on mute. Classic error.
I thought I'd frozen. You know, I thought I'd frozen. I was looking at I don't know if anyone saw me looking at my screen thinking, no, I haven't frozen again. Sorry. Go ahead. What can we do as a community to raise awareness about mental health in the community?
It's what we're doing right now. Things like this. We just got to talk. How are you doing? How are you doing? How are you really? Tell me your story.
Yeah.
What has been the most stressful aspect of your life? How did you deal with that?
Yeah.
Have you got? Have you got over that?
Yeah. And is this something that you would say extend? Because I know I find that it's more likely to happen when we do organize things like this, but inside our homes, when we're not having to discuss it to the public, how do we raise those awareness when, for example, if between a parent and a child, between an uncle, between neighbors?
It's one of those things, like driving becomes automatic.
Yes.
When you learn how to drive, you like how to do it. Then after a while, it's a case of like, okay, yeah, you know how to do it automatically. I think we have to have certain actions which become second nature to us. Like, so like, but the questioning, going deep, not accepting the first answer.
Yeah.
We have to do that, but also be mindful that it doesn't become, what we're trying it not to be. Like, how you doing? No, really, how you doing? So, all right, I know you're going to ask me twice. You know what I mean?
Yeah. Okay. Yeah.
But we got to make it as a, not, ritual's the wrong word, but it's kind of, we have to embed it as in our regular everyday practice.
Yeah, it has to always be as like a routine.
Yeah. So myself personally, with my children, it's a case of like when they came home from school, I'd spend time with my son, and I'd just ask him, after the homework stuff, like, how was your day? And I'm like, talk to me about your friends, who did what, who said what, who did this.
Yeah.
But then that's where that's where also it's good to have a community, because for my son that really worked.
Yeah.
So the bond with my son is tight, and even me, I mean, he's mentally very strong. But the same technique I tried with my daughter. She don't want to know. She doesn't want to. She does not want to talk to me about this. So, other people. She spoke to other people.
Yeah.
So that's useful to have a community that side. So it's not necessarily. Sometimes it's not always. The parents aren't always necessarily the best people.
Yeah. So I guess understanding as a parent that sometimes it may not be you.
Yeah.
And Sylvia, how would you say we effectively pass that on to your child? Like, okay, maybe I don't understand you, but you can speak to a professional. How do we encourage the young people to understand that there are resources outside of our home?
So whilst Dominic was speaking, I literally wrote down home front, understanding the difference between respect and fear. Many times, like Dominic said, his child is very open to talk to him about it, his son. You see that many kids, especially when they feel like, oh, I don't want to say this because I don't want to offend my mom, or I don't want to upset my dad and make him feel like I'm not, like Andrew said, I'm not man enough. I'm not strong enough. I should have spoken up for myself. We as parents now, or adults who have young people around us, we need to understand how to identify when a child is afraid and when a child is respectful. We need to start giving children. I come from a community where when adults are speaking, you keep quiet as a child. We don't want to hear your voice as a child. But then as a young, I think I'm young, as a young mom now.
You look young.
as a young mom now, when I'm doing anything and my daughter is there, I want to hear what she has to say. I want to hear her opinion. Obviously, it has to be a child-appropriate conversation. It's not just going to be any conversation. I said to a friend of mine the other day, if I got a penny for every time I heard, "Mommy, can I tell you something? Mommy, can I tell you something?" I would be a billionaire right now, because it's in those little, "Can I tell you something? Can I tell you something?" that you hear some things that would make you go, "Oh, is this a do you get what I mean?"
So listening, really listening.
Oh, really listening, and having that opened up policy where you say, you're just come to me for anything. I'm always here. come to me for anything. So there has to be like an understanding where kids know the difference between respect and fear. So they don't mistake it. And I think it falls on us as parents. It falls on us as the adults, because the way it's like Newton's third law of motion. For every action, there's an equal and opposite reaction. So the way you act to a kid would actually, it speaks volume on how they react to you. So I think it's one thing that we really need to work on at the home front. Make sure that these kids understand that you can talk to me, because I kid you not, the worst thing that can happen is for that child not to be able to talk to you and then go out and speak to the wrong person. I can talk about this all day long. I can talk about it all day long. There's so many instances where we could have caught a situation that went really bad from the onset. There's so many instances where we could have literally caught hold of it and sorted it out in a more less explosive manner, as opposed to it going the wrong way. And I like the fact that Dominic brought up the whole community, having that community spirit, knowing that, if I'm not here, my child can speak to this auntie and this uncle, having that child leave that community and go out and speak to someone who doesn't really understand, because no matter what we say, our children will always have our identity, our culture, our values. It's almost embedded in them, because they are mirror versions of us. They see what we do and they almost act the way we do. So a person who is not within that community can mistake something from that culture or from that community as, oh, you're being treated, you're being maltreated, without understanding that this is a cultural thing. You need to understand how culture, value, religion, beliefs, it plays a role in the way we act, in the way children act, in the way adults act, I think whoever meets me for the very first time, probably without looking at me or my mannerisms, you would know, okay, I come from a culture where we respect adults, just because an adult is talking, I don't have to talk back. It doesn't mean being spoken down on. It just means that I'm giving them that respect to speak their mind. And then if I need to speak back to them, I probably would not address them in a room full of people. I can always go behind closed doors and address them. It's a cultural thing. And I think if we start helping kids understand that, yes, there is respect, but there is also fear, and break down those aspects of fear and say, you don't have to be scared. Because certain kids will say, oh, I'm scared. What are you scared of? Let's have that conversation. What are you scared of? What's making you afraid? And then we start opening those layers to find out, okay, this is why this kid feels this way. And then maybe we as adults, we can tone down. It could be the way we speak, the tone with which we speak to them.
Your
that
reactions.
Makes you feel, the way we
it's very
react.
common as well, I think, in some of our cultures to have very big reactions, isn't it?
And I think sometimes it's not intentional to react that way. It's because we ourselves do not have outlets. It will shock you to know that a lot of adults from all communities do not have outlets. So you're like a bottle of Coke. There's the pressure, there's the work pressure, there's the relationship pressure, there's the family pressure, there's the pressure from responsibilities in terms of financial responsibilities, all that. And then it's like you have an extra one. And in that moment, how do I put it? In that moment, you're almost in a place where you're comfortable, you're home. You react in a way that you feel like nobody can see me. But there's a little person. There's a little person there watching, know? So I think as adults, we also need to have that outlet where we where we let the steam off a bit so that we give room to hear some of the things that's happening within our home front.
Yeah. What you said that reminds me of something I've heard before in terms of mental health, that sometimes you need to pour out what's in your cup before you let someone else pour in. I guess it would go with what you were saying, that sometimes with children, for us to actually be skillful and ready to take in what they're saying, we need to pour out what we've got in our own cups. Because as you were mentioning that you gave the example of children saying, "Mummy, I wanted to tell you something," or "Mummy, I've got a story to say." One of the first things I thought was, "Oh my gosh, I know that." And for me, sometimes if I'm having a long day, I'm like, nope, logged off. Even if I say yes, but in my head, I've logged off, and then they're talking and I don't know what I've picked up or haven't picked up. And it's so easy to actually miss a lot. So as you were explaining those things, I was thinking, actually, yeah, that's very true. Because if I hear, "Mummy, can I say something?" 5 times, I'm done. Because maybe I haven't used an outlet. That made me realize that maybe I haven't pulled out for myself to take in, you know. Yes, so I wanted to say thank you to that. Just to kind of wrap up a little bit, because we're coming to it, and unfortunately, I feel like I can actually do this for another hour or two, but I'm sure you guys have things to do. I don't, because I'm enjoying this so much. I just wanted to ask everyone, moving forward, I know some of you already answered this, and we've kind of taken little bits and pieces, but moving forward, how do we encourage everyone to access mental health resources? How do we do that as professionals and as communities? How do we encourage everyone in our community to access the resources that are there? Because there is a hesitancy to access it. What can we all do? Let's start with, I'm going to start with Ian.
Well, first and foremost, we need to be getting into the community. So stop expecting people to come to us. We need to get the message out there. We need to help people understand and realize, where are those access points? How do we get that support and all of the information for that support? So whether that's actually in the community itself, whether that's in schools, you know, whether that's in just popping to the town centre and showing we are there and being there in different projects, or over social media, for example. All those different areas, we need to have a strong presence.
Thank you for that, Ian. So as professionals, making yourself available, going in there into the community. Don't expect people who don't know about the access to come to you. Make yourself useful, be productive, go into the community and let them know what there is out there. Kidest, the same question. Moving forward, what is your advice in terms of encouraging people in the community to facilitate and use the mental health resources that are there?
Yeah, I would say it's similar to Ian. It will be mainly educating them. Educating them what mental health means and identifying signs, symptoms, because sometimes they don't identify whether they have mental illness or not. So, you know, the more we teach them, the more we talk, they can even identify the sign, they can pick easily what's going on with them. And also informing them what services are available, and also like informing them it's confidential. I think that's the main thing. Informing them is confidential. That will help them to come out and to feel free to speak out. That's the main thing. Confidentiality is the main issue between Black community, which I understand. And educating them.
So highlighting the importance of like the fact that the information is all confidential, because I know we're very mindful about that, and I know that sometimes in our culture and tradition we often hear, don't tell anyone our business, don't tell anyone what happens here. So people want to be reassured. That's important. They want to be reassured that actually what's happening here is staying in here. It's not going to go any further than that. Thank you, Kidest. Dominic, can you hear me? Are you unmuted? I can't hear you.
Well spotted. Well spotted.
Okay. Yeah, I had to check that time. Your turn now. In terms of the organization you work with, how do you encourage your clients, patients, anyone you come across to really access the mental health resources that are available to them?
Well, firstly, I will repeat what other people have said, is the confidentiality aspect. That is key, because there's already an issue of stigma. So, you know, confidentiality is at the very start of the conversation. But then also there's another aspect I think we jumped the gun a bit there, of going like, okay, access the, so because there's the aspect of being able to actually identify within yourself or your colleagues or your peers, etc., that there is an issue. So there's, I mean, I know we're running out of time, but there's that self-care aspect.
No, we've got time for this.
So, you know, it's a case of like, okay, you know, being proactive is better than being reactive. You know, so it's that case of like, you know, okay, checking yourself, going like, okay, just like Sylvia said, like she used that example of like, you know, oh, I woke up today and I felt quite low, da 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 da. So, you know, you like people do themselves going like, okay, okay, well, asking themselves, all right, I'm feeling down today. Why am I feeling like this? Then like, okay, do I have the tools to myself deal with this, or do somebody I need to talk to? Am I recognizing these same traits in people I come into contact with? Do I need to have a word with them? And then you go like, okay, right, maybe yourself or your person you've been speaking to, guy, you know, okay, have you thought about accessing a service that is confidential?
Thank you. So again, you highlight the importance of confidential. You know, that's something that a lot of people from the Black community need, that sort of reassurance. We need to know that we can trust people, and what's ours can be trusted to stay within the four walls. And actually, there will be help after I reveal the things that are very confidential to me, and also being able, like you said, being able to acknowledge whether you can actually. Being able to acknowledge that actually I'm seeing a pattern here before actually knowing I need to go get help, is being able to identify with that. I wanted to actually ask you, Joe, how do you, or should I say, what if someone isn't able to really define that, yes, I need to go get help? What would you say to them? If there is someone out there that's sort of like, can I deal with this? Well, I think I can. Where do they go from that moment?
That's a good question. But what I think what I talked about during our conversation this evening is about connections with people. And Sylvia was very much speaking about connections with family and cultural expectations around that. And I mean, Dominic in his work, you know, really tries to provide role models and trusted individuals for people to speak to. And I think it's about connections. It's about reaching out to someone who you trust. Sometimes that could be a neighbor. It could be someone, you know, I think self-care, like Dominic says, is really important.
Yeah.
We don't always know what to do about that, but the more we flood social media and the media with messages about self-care, you know, better sleep, better fitness, better, you know, the messages are there, but I think it's about every one of us playing a part in reaching out to people, in saying hello on the street, in, you know, becoming a part of people's day. And giving someone, you know, that can give such a lift to someone. I think it's important to recognize the small things that we can all do on a daily basis.
Yeah. So would you say that making connections with people is part of actually maybe able to ask someone, can you openly ask, do you think I'm coping? Because, you know, some of us second guess ourselves. You may think, actually, am I coping or not? I'm not really sure. Is this a good moment to go back to that connection you did make and actually be able to kind of get?
Yeah, I think it's easy for each one of us individually to believe that we're the only one who's experiencing that. Whereas actually many of the people we come into contact will be having, you know, feelings of all those feelings that we've described this evening, really. No, we're not alone. But it's only by making connections with people and building those relationships, which, like I say, could be family, could be friends, could be neighbours, could be professionals providing services. It's about finding someone that you can trust and being able to talk about, to start talking about it.
Yeah, and thank you for actually sharing that, because I think often when we do think of mental health resources, I think thinking of close friends or family is really quite far-fetched. I think it's always sort of always like a professional perspective. So thank you for highlighting that. That's one of the answers, people moving forward as a community, making connections, speaking to people who are near you. And I think that's something a lot of you mentioned actually today. I think Sylvia mentioned it. I think most of you actually mentioned that, being able to make connections and little conversations and self-care in terms of the little things you can do, as you said, taking care of yourself, better sleep. I had actually someone tell me that actually sometimes we do the little things that are self-harming and we don't acknowledge, we don't see it as self-harming, like going to sleep late, depriving yourself of sleep. So I guess being mindful of the little things. Let me go to Andrew. Andrew, from your experience and your area of expertise, what are some of the things that you could say we could do in order to help the Black community be in awareness of mental health resources?
Yeah, I think how I was just thinking there, how great would it be to have, you know, some elders in the community or some, you know, key people in the community almost like trained up as mental health first aiders, you know, to be there. So if they do need to help, you know, you can help signpost people, you can help explain, be a listening ear for them, you know. That would be great. I'm actually doing mental health first aid next week, so I could be first on the list for you. But yeah, I think that would
there you go. Being an example.
Yeah, and even just having the conversations and being able to, you know, if somebody does come to you, have the confidence to be able to, you know, be calm and collected and, you know, not be shocked, angry with them, and just have, again, the open conversations with them. For me, something that's really easy and straightforward and something that we talk to our young people about and is, you know, trying to be more mindful. So again, you know, mindfulness isn't just like sat in a dark room doing yoga or whatever. It's just, you know, being more present in the moment. So it could be, you could be, you know, watching Netflix and just be a little bit more mindful. I'm the worst, so I'll watch football, but then I'll be sat on my phone, you know, texting people and not giving it that full attention. Are you the same, Trish?
That's me. And I call it multitasking to make myself feel good, but you're really dragging me right now. So I understand. I'm taking this in.
Yeah, I can't multitask, but that's a different story. But just living in the moment a little bit and just not worrying about the future or, you know, worrying about the past and just and again, you know, in this current climate, it's just really important, just as everyone mentioned, you know, the self-care, being kind to yourself, being kind to others, saying hello to your neighbor, smiling when someone's walking past. It makes such a difference, especially the elderly community as well. You know, it makes, you know, next time you go out for a walk, just smile and say morning, hello. I know us Northerners are always friendly anyway, aren't we? But it makes such a difference. Like I mentioned, I've got 2 little boys, and when we take them out to play, you know, everyone's always saying hello to them and, you know, smiling to them. And again, it makes such a difference. Again, you know, just I do something with my little boys, you know, getting them to breathe through the nose, you know, breathing out through the mouth, just again to relax, bring them back into that moment. They don't realize they're doing mindfulness, but again, it's disguised. So, early intervention, just trying to get these different activities in from young is a massive one.
Thank you. There seems to be a repeat of early intervention rather than waiting until you have to. Intervention over prevention, basically. Thank you for that, Andrew. You basically stated mindfulness and being present as a way to move forward. And finally, Sylvia, what would you say, what are some tips or what could you say that we could do to help the Black community be more awareness in terms of the mental health resources that there are out there?
One thing I always say is you don't have to be trauma consumed to be trauma informed. I think that's one of the awareness that we should throw out there so we can be more open to helping people within our community, because most times, like I mentioned earlier, in order for me to catch the attention of most of my participants or people within my community, I have to have a trauma story so they can relate with it. So we need to help people understand that I don't have to be trauma consumed in order for me to be trauma informed. You know, you've got to seek help. You've got to seek help. Be open to talking to people, professionals. Another thing is, if you're always follow your instincts, if your instincts tell you that you need help, please learn to say no and learn to follow your instinct, because we've had instances where people have gone to GPs and GPs haven't been able to put a finger on it. It's a game of numbers. Oh yeah, this, that. You have a cold. And then you don't go on to seek second opinion. And I'm speaking from personal experience. And then you go on to seek second opinion. We need to start teaching people how to seek second opinion. If you're not comfortable with the first prognosis or diagnosis, please seek second opinion. Don't just take the first opinion. If deep in your heart you know that whatever it is this person is telling me is not the way I'm feeling, always seek second opinion. No one is going to come for you, you know. And like Andrew and every other person said, mindfulness, you know, being kind. I think in a world where you can be anything, choose kindness. You know, be kind to everybody, because you never know that smile, that hello, that are you okay? It's one thing that can definitely make a huge impact on someone else's mental health.
Thank you for that, Sylvia. Thank you for that. So in terms of what Sylvia's saying, she's added that we have to in terms of what Sylvia said, we have to be kind. We have to trust your instinct. So know better. Even if you get advice from a professional that you feel doesn't quite sit right, be persistent. It's okay to go back and say, actually, that wasn't accurate, or that's still persisting. Are you sure? Trust in your gut instincts when it comes to your mental health, because nobody can feel it like you can. Thank you so much, everyone, for being part of this conversation. Thank you to all the panelists. You guys have been amazing. I could actually do this all the time, because I kept having to look at the time and I was like, whoa, we're gone past. I didn't know that, because I thought we had another 15 minutes. That just shows how insightful this was for me. I just want to thank all the viewers that have tuned in as well. And again, thank you to Taste of Africa Northeast. Part of the biggest things that we can do in terms of raising awareness, pushing mental health resources further into the Black communities, is sharing videos like this. So do make sure you share, pass it on. Do give us a comment if there's anything in particular that you felt like we didn't touch up in and you would like to see more of this. And please do make sure that you tune in to our next episode. We will be talking about domestic violence. Do tune in. Let's educate each other. Let's share videos. Let's support each other. And guys, remember to take care of your mental health and be open, be kind to each other, trust yourself, make connections. I'm trying to remember everything I've learned today. Thank you guys for coming to watch Let's Talk. Thank you to all the panelists. I'm your host, Trish Balusa. I think I just realized that I didn't even introduce myself. I'm so sorry, guys. I'm Trish Balusa and I'm your host. And I cannot wait to see you guys again to have another insightful conversation. Despite the challenges, we have to do this so we can do better. Thank you so much. You guys take care. Have a good bank holiday weekend.
Thank you.
Thank you, guys.
Bye.